The fact that estrogen receptor positive breast cancer patients have an increased risk of osteoporosis is frequently addressed with prophylactic supplements without first assessing if the patient is vitamin D or calcium deficient. Is this clinical practice evidence-based? In the general population, the available scientific data shows no clear role of vitamin D supplements for any health outcome unless the patient is vitamin D deficient, and that administering calcium supplements to unscreened people does not prevent fragility fractures or osteoporosis, potentially increasing the risk of kidney stones, gastrointestinal side effects, and cardiovascular adverse events. In the breast cancer population, although calcium and vitamin D supplements are widely recommended for osteoporosis prevention since forever, supplementation's efficiency in this specific patient's population has not been tested against an unsupplemented control group. In 2013, Data and Schwartz conducted a systematic review of trials in which calcium and/or vitamin D supplements were recommended to women with breast cancer. The reviewed 16 trials showed that 1,500 milligrams of calcium and 1,000 IU of vitamin D are inefficient in preventing bone loss in these patients, virtually every trial showing continued bone loss despite supplementation. Authors concluding that the other lifestyle changes and pharmacologic interventions may be required to prevent bone loss in breast cancer patients. But osteoporosis prevention knowledge is low. Taking vitamin D and calcium supplements and maybe an annual bone scan being the most osteoporosis prevention breast cancer patients receive, much of these patients receiving no education in osteoporosis prevention. It is true that in the busy day-to-day clinical practice, many healthcare providers don't find the time to also educate the patient about counteracting treatment side effects, and that these supplements are generally considered quite safe. But the general safety showed in some trials is questioned by others. For instance, in the recently published D-Health trial, administering vitamin D supplements monthly to unscreened older people being consistent with increased cancer mortality. Despite the low knowledge and sometimes low perceived seriousness of osteoporosis, many breast cancer survivors believe in the importance of keeping healthy. We, as healthcare providers, can at least give them the information. And while we cannot change the existence of the cancer diagnosis and treatment, of the color of their skin, or of their family history of fractures, osteoporosis is widely recognized as a preventable disease. However, the healthy bone behaviors require a bit more effort than just taking some pills. The regular practice of physical exercise, spending time outside in nature, replacing yo-yo dieting with balanced Mediterranean diet adequate in protein, carbs, vitamin K, D, and dietary calcium, stopping smoking, and also maybe the mindful intake of caffeine and alcohol, all are bone healthy behaviors important to be practiced day by day. Fragility fractures remain important medical, social, and economic problems worldwide because osteoporosis is one of the many consequences of an unhealthy lifestyle we cannot wipe out by taking supplements. In conclusion, the current scientific data shows that the prophylactic use of vitamin D and calcium supplements in patients without these deficiencies is an eminence-based osteoporosis quick fix that minimizes the complexity of the issue. Thank you.